Hello everybody, my name is Kerry Lane, representative for the Union of American Physicians and Dentists, UAPD. We are here to alert the community about Unity Healthcare's ongoing disrespect for Washington, D.C.'s frontline healthcare providers. The 150 Unity providers who have organized with UAPD, who stand here in solidarity, care for more than 80,000 patients across all wards of the city. They are the frontline providers who risk their own health every day to treat our city's homeless population, the poor and the disadvantaged, at more than 20 community clinics. And at this very moment, Unity's providers are behind us, risking their safety to provide care for inmates inside the DC jail. Yet, Unity continues to disrespect Washington, D.C.'s essential healthcare workers through unsafe working conditions, through a culture of bullying and intimidation, a revolving door of overpaid executives, lack of transparency and communication, lack of breaks or administrative time for these providers, withholding of workers' pay, and schedules that have left us overworked and exhausted. The deplorable working conditions are so bad that 24 of Unity Healthcare's providers have resigned in the last 3 months alone. We have asked for reasonable improvements to all of these issues to finally give these essential workers and the patients they treat some well-deserved dignity. But thus far, Unity has responded with delayed negotiations, retaliation through withheld pay, and the refusal to improve safety measures, as well as attempts to silence our voices with threatening policies. But we will not be silent. This is now a community issue. Unity's disrespect of our frontline healthcare providers is bad for patients, and it's bad for Washington. We have several people who will speak about this alarming situation, including the providers themselves. We will begin with Stephen Kaufman and Anthony Herman, UAPD's lead negotiators, to discuss the unfair labor practice charges that UAPD has filed against Unity management.
Thank you, Kerry. I want to talk about the unfair labor charges that Union has filed against Unity. And they reflect our belief that Unity is not bargaining in good faith. Among other things, Unity has not responded to the union's substantive requests, their proposals for change. There's been nothing in writing, including the request for workplace safety, that it be addressed immediately and not wait till the end of a collective bargaining agreement. They just have not responded to that. We've asked for things like signs that would prohibit weapons on site, better protection for people, for patients and providers, asking to have doors locked, receptionists that can make sure that people don't come through who don't belong there. And in particular, in the jail, there is a massive need to overhaul the protection of the providers who have to deal with as many as 50 to 100 inmates a day. We have filed an unfair labor charge for their delay in coming to the table to talk about these important issues. We have an expectation that we would negotiate twice a month, which would be normal and usual. Unity refused to come to the table until mid-March, even though we proposed in February, and they won't come again until May, the middle of May, a full 2 months with excuses, well, without excuses. They've just canceled without excuse, not coming to the table. Unity is making it hard for the providers who are on the negotiating team to come and negotiate with them. They are refusing to pay the negotiators for their work time that they come. You come during the day to negotiate. They won't pay them, which is a typical thing for companies to do. they won't compensate, and they're making the scheduling of meetings, or attempting to make the scheduling of meetings, as expensive for providers as possible. We have proposed evening meetings, or at least afternoon meetings, and they insist on scheduling from 10 to 2, which crosses against 2 provider shifts, forcing providers to give up a full day of work uncompensated. They have delayed giving us important documents. They have Unity's executive director made a YouTube video saying that the company Unity does not have enough money to pay bonuses that have traditionally been paid to its providers. At the same time, they have utterly failed to give us the documentation showing how much management is making, how much management is paying itself, how much bonuses management has given itself, and what management's benefits are. And lastly, they're trying to gag our union members. Union members have a legal right to protest these conditions, and Unity has written policies that would supposedly keep members from talking to the press, from lobbying politicians for their own goodwill and the goodwill of the people of the patients in DC. And we have proposed many times, and we have asked them to say that they will not enforce what we believe are their illegal prohibitions on talking to the press, and to date they have refused to do that. With that, we'll turn it over to our first provider, Shantae Whitaker, who is a PA, a physician's assistant in the jail. Thank you.
Hello everyone, my name is Shantae Whitaker. I'm a practicing physician assistant at the DC jail. I think the biggest issues that we have been dealing with thus far is safety, provider safety. I have been threatened. I have been verbally threatened. I've had patients write verbal things that were just very alarming and distasteful, and I have alerted management about some of these things with no response. Right now at the Department of Corrections, CTF, we're having issues with the doors not locking, giving patients access to certain areas they should not have access to, and there has been no response from anybody in an administration. There's constantly administration not at work. They abuse their hours, abusing their time, and simply is just not responsive to any of their providers' needs. I will also say compensation is an issue. Unfortunately, there is no HR at Unity. They fail to respond to emails in regards to timely compensation, concerns in regards to safety, concerns in regards to not having a medical director for months at a time at DC jail, and no response or implications onto why we don't have a medical director, and poor communication. So these are a couple of my issues that I'm having here at the DC jail with Unity. There has completely been no communication and no advocacy for providers with Unity.
Hello, I'm James Tracy. I'm a family nurse practitioner at Upper Cardozo Clinic. I've been working there for over 11 years. So as family nurse practitioner, I practice in primary care. And through the years of working at Unity, I've worked with amazing quality people, the kind of people who are willing to work in a jail. They're willing to work in a jail. They're willing to go into the streets and into the shelters to take care of the unhoused in Washington, D.C. In my case, I was working in the front lines of the pandemic without taking a day off at any point. And every day I work in order to, my goal is to take care of the most complicated and the most vulnerable patients in Washington, D.C., my neighbors and fellow Washingtonians. So that's the kind of work, these are the kind of people that we have at Unity. They're wonderful providers who are committed to doing a difficult job. But right now, during the course of our day in the clinics, we do not have enough time to see our patients. We do not have enough time to complete the paperwork we're expected to complete. And when you don't have enough time, all the things that Unity wants us to do and all the things that we want to do and the patients need, they sometimes don't get done. For example, when I see a patient, I'm going to be managing their diabetes, their blood pressure, doing screening tests like mammograms, pap smears, colon cancer screenings, and explaining the safety of life-saving vaccines. So to do all those things in a short period of time, like 10, 15, 20 minutes, I mean, one of those things has to be skipped. And Unity, and I think that the greater Washington community, they don't want primary care people skipping these very important things. We want to be able to do all of the things that we're expected to do in primary care. This is not an urgent care. Because if we're not doing it, nobody is. This is what primary care people are supposed to do, and we want to be able to do all of it. Not to mention taking care of children, doing their well child checks, and taking care of their physical and mental health. So our goal here is to make Unity the kind of place where people want to work, that we can recruit and keep recruiting wonderful providers. We want to be the kind of place where we retain the wonderful providers who are already here. We want to work together with Unity to create a great contract that makes this a sustainable job. We are right now, we're putting in our extra time. You could tell, I mean, we're doing this on our own. We're not getting paid to do this, but we're doing this because we truly believe that this is the best thing for Unity. And that's it. Thank you so much.
Next we have Dr. Drew Martin. He's a family physician at Parkside Clinic.
Good morning, and thank you all for being here today. I'm Drew Martin, family physician. Yesterday, I was inside the jail here, providing well-needed chronic medical care to our patients who are currently incarcerated. As a preface, as a medical student, I rotated through Unity Healthcare. As a resident, I trained at Unity Healthcare. As an attending, I work here at Unity Healthcare, which is to say that I believe in the mission of Unity Healthcare to provide medical services to our sheltered, our incarcerated, and our disadvantaged patients here in the district. But over the past year, over the past months, I've become worried that won't be happening going forward unless we take action here. And collectively, the situations that have come up in the jail, in the homeless shelters, at the clinics where I go every day, have become unbearable to the point where dozens of providers are leaving. Every day it seems like I go in and talk to my colleagues and another person has decided that they're going to leave to a private practice or go home to wherever they call home. A lot of our providers come here for the purpose of serving, and we feel like we are not being served ourselves. In that case, I want to put my full support behind our union here and the force of our negotiations. Unity Healthcare, in some way or another, has been here for 40 years, and we want to be a part of the next 40. Thank you.
And the union and our representatives will continue to let the public know and update them on progress. We are hopeful that Unity changes their ways and comes to the table and bargains in good faith. This is an opportunity to improve, nothing to fear from Unity, and we will get a fair contract for these essential workers. So stay tuned and thank you very much.